Hello everyone, the stage is set, the day is on, and we welcome you wholeheartedly in the India's biggest medical PG prep academic event, the DAMS Physiology 2023. Apna time apun khud laega. We all know learning is a continuous process, and it has been very wisely said. Better than 1,000 days of diligent study is one day with a great teacher. We are all set to have a session on psychiatry by our esteemed faculty, Dr. Sachin Arora. Let us learn the new vistas of this wonderful subject. Dr. Sachin Arora is an MBBS graduate from GMC Nagpur. He has done his MD Psychiatry from GMC Guwahati. A consultant psychiatrist in Delhi for last 9 years. He has been teaching in DAMC Medicos for 10 years now. His most cherished memory about DAMS, he says every moment is cherishable, but there was an incident where one of the students made a clipping out of which he made a meme and which was like viral, and his family came to know about his activities in the classroom. Well, that's wonderful. Let's spot on start psychiatry with Dr. Sachin Arora. Over to you, sir.
Thank you so much. So, you were listening to Mr. Ayush Sharma, who has been introducing all of us. I would like to thank Mr. Ayush Sharma for that. And good morning and welcome to all for last day of DVT, and this is psychiatry. Okay. As far as psychiatry is concerned, it is a short subject for PG entrance. Hence, we have kept this session short and crisp. There are 1200 pages in this DVT, and the shortest was supposed to be psychiatry. 9 pages only. Okay, only and only 9 pages. You can see this DVT workbook, and we have kept psychiatry as the shortest of all. Okay, are you ready for it? I'm just waiting for the people to settle down. There are students who are attending at DAMS centers. Okay, I know that you are attending at DAMS centers. I hope you all are ready. Shall we begin? Okay. The first is psychiatric symptoms. That is general psychiatry. Okay, general psychiatry. In general psychiatry, the first table is thought disorders. This table you have seen previously if you have attended a lecture. Thought disorders are divided into 4: form of thought, content of thought, position of thought, and stream of thought. Form of thought, content of thought, position of thought, and stream of thought. There are 2 types of questions asked on this. One is a classification. Which of the following is a form of thought, which is content, which is position, which is stream, and other is the clinical features. The clinical features based questions. So we'll discuss one by one. In form of thought, loss of association is also known as derailment. This question came in NEET 2021. The question was, derailment is a disorder of form of thought. In this, the individual parts of the thoughts are not connected to each other. Such that the speech is not understandable. Individual parts of the thoughts are not connected to each other such that the speech is not understandable. Okay, a similar thing in form of thought is neologism, in which the patient uses new words that are not understandable. So the common to both form of thought disorders is that they are not understandable, and both of these are seen in schizophrenia. Derailment and neologism, both of these are seen in schizophrenia. When the patient uses a new word that is not understandable, neologism. When the patient talks irrelevant, so the thoughts are not connected to each other, not understandable, derailment. Both of these are seen in schizophrenia. Then comes content of thought. In content of thought, again there are two terms. One is delusion, one is obsession. Delusion is a false, firm and fixed belief. That is unshakable. First question for people who like to chat too much is most common delusion. First question to people who are active in the chat is most common delusion. Come on. Fastest finger first. Most common delusion. Let's see who can answer it fast. Most common delusion. Let's make it live interactive. Ashish Simon. Delusion of persecution. Paranoid delusion. Paranoid delusion. Correct. Second thing is obsession. Obsession is a disorder of content of thought. It is a repetitive, ego-dystonic, irresistible thought. Distressing, repetitive, ego-dystonic. I'm just writing the key features. Obsession is ego-dystonic, repetitive, irresistible thought. Now comes possession. Today this session is happening on app. Yesterday when this happened in auditorium, I made all the students do it. And I suppose you sitting in the classroom or at your home can do it. What are the three things? Thought insertion, thought withdrawal, and thought broadcast. So yesterday 1500 students did it. Let me do it for you. Thought insertion. Outside thought come in your mind. Thought withdrawal. Your thoughts are known to other people without speaking. Thought broadcast. Your thoughts are known to many people without speaking. बाहर से थॉट आ गए, इंसर्शन. चले गए, किसी और को पता चल गए बिना बोले, विड्रॉल. सबको पता चल गए, ब्रॉडकास्ट. Do you people remember this? Insertion, withdrawal and broadcast. Just imagine you are attending this class in your library reading room with your headphones on, and teacher tells you to do this and you are doing this. Then the other people will get a feel. That's why it is a psychiatry class. असर आ रहा है. वीडियो को देखकर बच्चा ऐसा ऐसा कर रहा है घर में बैठ के अकेला, कुछ तो गड़बड़ है. Insertion, withdrawal and broadcast. Then come stream of thought. Stream or flow of thought include flight of idea, in which speed of the thought is increased. In flight of idea, thoughts are connected or not connected. Connected by one word, such that the speech is understandable or not understandable or partially understandable. Partially understandable. You are supposed to know how to differentiate loss of association from flight of idea in a clinical question. You are supposed to know how to differentiate loss of association from flight of idea in a clinical question. In flight of idea, speed is increased. Similarly, in clang association also speed is increased, but words are linked to each other by rhyming. Words are linked to each other by rhyming. Rhyming. Today I am glad thanks to my dad who gave me an iPad. Now I'll not be sad. Thank you dad. I am glad I got an iPad. Hey. इसमें तेरा घाटा मेरा कुछ नहीं जाता. ज़्यादा प्यार हो जाता तो मैं सह नहीं पाता. Okay? Clang association. You remember both the examples. That's why I am repeating the same examples which I said in the class, so that you can relate. Slowing of thinking, in which the speed of the thought is slow. Perseveration, giving same answer to every question. I ask my patient, what is your name? Ram. Where are you from? Ram. What do you do? Ram. What's your occupation? Ram. What are you doing in the class? Ram. Perseveration. Thought block, sudden break in the train of thought. Thinking, and ये hang नहीं था. I was demonstrating thought block. Okay? Thinking, and you suddenly stop. It will manifest as speaking, and you suddenly stop. Circumstantiality. Circumstantiality means beating around the bush and reaching the answer. I asked a student, tell me the number of spores of Clostridium tetani. Sir, there are 4 species of Clostridia. Clostridium welchi, Clostridium perfringens. I said, wait, tell me tetany spore. Sir, you wait. I am telling no. Let me tell what I know. Then I will tell you what you want. घुमा फिरा के आंसर देना. Circumstantiality. Tangentiality, touching the question but leaving at one point of contact. I ask my patient, how are you feeling? Feeling? The sofa is feeling very soft today. Hey. Tangentiality. Now, the most common question. You will be given a speech sample and you are asked to differentiate these 4. Today, what I have done is, the theme of my DVT teaching this time is differentials. Every time we come up with a different theme, mind map version, integrated version, workbook version. This time my theme is differentials. There are a lot of students who know what is loss of association, who know what is flight of idea. When the question comes to differentiate between the two, they are not able to. So I'll speak a speech sample. The 4 options are loss of association, flight of idea, circumstantiality and tangentiality, and you are supposed to mark. आप बताएंगे जो मैं स्पीच बोल रहा हूं वो LOA है, FOI है, सर्कमस्टेंशियलिटी है, टेंजेंशियलिटी है, और पूरा नहीं लिखना है. चैट में सब कुछ नहीं लिख पाओगे तो ऑप्शंस हैं 1, 2, 3 and 4. रेडी? स्पीच मैं बोलूंगा, आपको 1, 2, 3, 4 बोलना है. I'll speak the speech. देखो मेरी बात सुनो. MCQ का एक बेसिक नियम है ऑप्शन को डिफरेंशिएट करना आना. The basic rule of MCQ is how do you differentiate options, and there are certain type of option that will always coexist. Now if there is a psychiatry question, one option is loss of association, other option has to be flight of idea. अब other option placenta previa तो नहीं होगा. क्या आप मुझसे आके पूछेंगे सर फ्रैक्चर नेक ऑफ फीमर और फ्लाइट ऑफ आइडिया में डिफरेंशिएट करके दिखाओ ना? बताओ. अब एक ऑप्शन लॉस ऑफ एसोसिएशन है तो अदर ऑप्शन हैज टू बी फ्लाइट ऑफ आइडिया. अदर ऑप्शन कान बी फियोक्रोमोसाइटोमा. मेरे सब्जेक्ट में दूसरे सब्जेक्ट के ऑप्शन की एंट्री बैंड है, तो आप इसी तक ही डिफरेंशिएट करेंगे. लेट्स अंडरस्टैंड. I asked my patient, how are you feeling? Jesus was a carpenter. I am the right hand of God. I don't offend anyone. Did I hurt you? Sachin Tendulkar plays square cut shot nicely. Why are you looking at me like this? Run Vijay Singh. Jamal Jamalu. What is this? 1, 2, 3, 4. 1, 2, 3, 4. 1. Loss of association. Thoughts are not connected. Speech is not understandable. Look at the speed at which the chat is moving. Have you ever seen such a speed? Look at the speed. 1, 2, 3, 4. 1. Let's catch up the speed again. I met Dr. Siddharth Mishra yesterday evening. Mishra is the name of a person who stays in my society. In my society there are 222 people. 222 was the score of Indian cricket team in one of the cricket match. Match is that which is played between India and Pakistan. Pakistan is a state where we go and play. What are you doing? Why is this happening? Next sentence is linked to the previous sentence by one word connection. 2. So if the speech is partially understandable and connected by one word, speed is increased, flight of idea. Can you differentiate flight of idea from loss of association now? Can you differentiate them? If it is not understandable, loss of association. It is partially understandable, flight of idea. ये मैं पहले ही बता चुका हूँ. Beating around the bush and reaching the answer. One of your friend asks you, what time did the class start today? You reply 10 a.m. Straight answer. Second, the class was supposed to start, but the teacher came at 9:58. Then he showed his video of the entry with reel which he has made yesterday. Then Mr. Ayush Sharma came and he told about him. Then we came to know he's a graduate from this college, postgraduate from this college, blah 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 blah. And finally the class started at 10 o'clock. If you give answer like this, straight. If you give answer like this, circumstantiality. Is that clear? Crystal clear concepts, no doubts, no confusion. No doubts, no confusion. And tangentiality already given example. Finished? The only clinical question will come on these 4. Sometime perseveration. In psychiatry, there are 2 types of disorder. Functional disorder, organic disorder. Functional means cause is absent or present. Functional means where cause or etiology is not known. And organic means where cause is known. All the functional disorders have auditory hallucination predominant. All the organic disorders have visual hallucination predominant. Consciousness. More likely to be impaired in organic disorder. Example, disorientation seen in delirium patient. Consciousness is normal in functional disorder. Example, all your mania, schizophrenia, depression, OCD. This is a very famous question. The question is, all are seen in mania except disorientation. All are seen in schizophrenia except disorientation. Because disorientation is only and only seen in psychiatry in delirium. It is a hallmark feature of delirium. I'll ask you this question in today's class only after 1 hour. What is the hallmark feature of delirium? And you are supposed to answer disorientation or altered sensorium. Organic means cause is present. Functional means cause is absent. Most of the psychiatric disorders are functional except few which are organic. What are included in organic disorder? Delirium, dementia, amnestic syndrome, all the disorders that were taught by my dear friend and senior and colleague at DAMS, Dr. Achin Mehra. Medicine CNS means organic. The people who have attended his regular batch class, you have seen a workbook he carries, Neuro Astra. Next year I am making a similar workbook, Psychiatry Shastra, just to match with him. So, whatever he has taught in organic, stroke, epilepsy, multiple sclerosis, Alzheimer, Parkinson, entire chapter of him is organic. So most common hallucination in psychiatry, auditory. Most common hallucination in neurology, visual. Is that clear? All of the following suggest functional cause except visual hallucination, which suggest organic cause. In order to diagnose any psychiatric illness, first we have to rule out organicity. A patient present to you with chest pain, palpitation radiating to the arm, sweating, diaphoresis. What is the first disease you think of? MI. MI is organic. ST elevation, organic. Investigation, normal, functional. Is that clear? Is that clear? All right. Most famous differential diagnosis in psychiatry. I have captured a few common symptoms that will come together. A few common symptoms that will come together. First case is psychotic symptom. If a clinical question comes to you in psychiatry, first differentiate neurosis from psychosis. If delusion hallucination are present, it is psychosis. If delusion hallucination are absent, it is neurosis. If it is a psychosis, it can be either schizophrenia or delusional disorder. It can be either schizophrenia or delusional disorder. These two options always coexist. How do you differentiate them? Schizophrenia is a condition characterized by split mind. So it will have delusion, hallucination, and abnormal behavior. While delusional disorder is only delusion. Everything else is nearly normal. So if it is delusion plus hallucination plus abnormal behavior, it is schizophrenia. If it is only delusion, it is delusional disorder. First point of difference. Second, schizophrenia has predominant socio-occupational impairment. Schizophrenia has predominant socio-occupational impairment, which is less seen in delusional disorder. Example, a person has a belief office colleagues are against him, they want to harm him. Despite this belief, he continues going to the office. There is no loss of job. Diagnosis, delusional disorder or schizophrenia? Just answer with initials, D or S. D or S. Delusional disorder. Correct. A person has a belief office colleagues are against him, they want to harm him. Despite this, because of this belief, he himself stops going to the office and stays at his home. D or S. D or S. S. Correct. Based on this, answer this question. I have brought few practice questions with you for you. Are you able to read the question? First question. Delusional disorder or schizophrenia? FMG PYQ. First case. What is this symptom known as? command hallucinations. And what is this? Stopped going in social function, socio-occupational impairment. Why I have brought MCQs like this? Because it is my observation that even after teaching the concept of schizophrenia and delusional disorder, some of you are not able to figure out what is a schizophrenia and what is a delusional disorder, because there is a problem. The problem is you understand the concept, but when it comes to apply it to solve a question, many of you do mistake. क्योंकि ये मुझे लगता है ये एक टीचर का डेल्यूजन है कि उसको लगता है कि अगर मैंने ये पढ़ा दिया तो आप जैसे होशियार बच्चे ऐसा सवाल सॉल्व कर पाएंगे, बट ये सबके लिए सत्य नहीं है. इट इज नॉट ट्रू फॉर ऑल. देयर आर फ्यू टैलेंटेड पीपल who after reading this then also answer this as delusional disorder. So it has to be like this. The most important essence of this class is not to tell about schizophrenia, not to tell about delusional disorder, but to tell how to differentiate them when it comes in the exam. MCQ का मतलब ही differential learning होता है. So you are supposed to know how do you differentiate this case from this case. Case number 2. Come on, मैं आपके सामने क्वेश्चन करके दिखा रहा हूं ताकि आपको क्वेश्चन करना आए. Come on. Compare this with the upper question. She is having a delusion. Which delusion it is? Delusion of persecution. Can you differentiate the two now? Except for these beliefs, her mental status is normal. Are you able to differentiate these two now? एग्जाम में यही आने वाला है. केस आएगा, ऑप्शन में स्किजो होगा, डेल्यूजनल डिसऑर्डर होगा. कर लोगे डिफरेंशिएट? डू यू थिंक यू कैन डिफरेंशिएट स्किजो फ्रॉम डेल्यूजनल डिसऑर्डर? यस, नो? ओके, थैंक यू. नेक्स्ट क्वेश्चन. बहुत छांट छांट के, बहुत सिलेक्ट करके क्वेश्चंस लाया हूं मैं आपके लिए. आई हैव सिलेक्टेड दीज क्वेश्चंस विद अ लॉट ऑफ एफर्ट फॉर यू. ये है आपका थॉट ब्रॉडकास्ट. But this time you did not pay importance to the duration mentioned 2 months. In psychiatry, please remember to keep an eye on the duration. Since the duration is 2 months, my answer would be schizophreniform disorder. Because as per DSM, less than 1 month is brief psychotic disorder. 1 to 6 months is schizophreniform disorder, and more than 6 months is schizophrenia. Please remember, in psychiatry you are supposed to see duration. But somebody might argue, sir, if it was as per ICD, yes, agreed. As per ICD, less than 1 month is acute psychosis and above 1 month is schizophrenia. But since it is not mentioned as per ICD or DSM, you will take it as DSM. Moreover, check out the options. If the option has acute psychosis, that means that they are talking about ICD. If the option has brief psychosis, that means they're asking you about DSM. Thought broadcast means my thoughts are known to others, many people in the planet. We just discussed this. Come on. Case number 4. Case number 4. Again an FMG PYQ. Once again, command hallucination. But the duration here is 1 week. 1 week means less than 1 month. The diagnosis will be either a brief psychosis or acute psychosis. Is that clear? So the case number 1, scenario number 1, psychotic disorders. Is that clear? अगर साइकोटिक डिसऑर्डर का पेशेंट आएगा तो यही ऑप्शंस होंगे, दूसरे नहीं हो सकते हैं. सबसे पहले क्लिनिकल क्वेश्चन में क्या देखोगे, साइकोसिस है या न्यूरोसिस है. delusion hallucination present means psychosis, delusion hallucination absent means neurosis. Delusion hallucination present, then check out socio-occupational impairment present, absent. Absent means delusional disorder. Socio-occupational impairment present, that means either this or this. How do you differentiate them? Duration. Is that clear? First see the disorder in question, delusion or hallucination present, delusion or hallucination absent. If absent, it is neurosis. If present, it is psychosis. If it is psychosis, check out socio-occupational impairment, present or absent. If absent, it is delusional disorder. If present, less than 1 month, 1 month to 6 months, more than 6 months. Is the flow chart clear? Is the flow chart clear? सबसे पहले देखेंगे delusional hallucination है या नहीं है तो साइकोसिस, नहीं है तो न्यूरोसिस. साइकोसिस है तो सोशियो ऑक्यूपेशनल इंपेयरमेंट है तो स्किज़ोफ्रेनिया की तरफ, और नहीं है तो delusional. Is it clear? केस 2, डिप्रेसिव सिम्टम्स. अगर क्वेश्चन में डिप्रेसिव सिम्टम है, इफ डिप्रेसिव सिम्टम्स आर गिवन इन द क्वेश्चन, द फर्स्ट थिंग इज टू check out whether there is a stress factor present. Depression can be without a stress factor or can be with a stress factor. If it is without a stress factor, then the diagnosis has to be depression only, because endogenous depression means depression without a stress factor. If it is after a stress, after breakup, financial loss, exam failure, it can be major depressive disorder, it can be adjustment disorder. How will you differentiate in the clinical question? How will you differentiate in the clinical question major depressive disorder versus adjustment disorder? How will you differentiate in a clinical question major depressive disorder versus adjustment disorder? Come on, answer 1 or 2. A student failed in class 12 board exam, after which he is feeling sad, not eating, not drinking, water, pani. Not eating, not drinking, not talking to the family members, crying for last 2 months. MDD or adjustment? One or two? One or two? Come on, come on. One or two? Two. Correct. A student failed in class 12 board exam, after which he is not eating, sad mood, crying, not drinking, water, not going out, not talking to many people, but he thinks his life is useless and he attempts suicide to take away his life. Diagnosis. MDD. Do you understand? If the symptoms are severe, suicide attempt, it is MDD. If the symptoms are mild to moderate, it is adjustment disorder. After stress, if it is mild to moderate symptom, adjustment disorder. If it is a severe symptom, major depressive disorder. Then second point, criteria of MDD is met. Here it is not met. What is the criteria of MDD? Anybody knows? 5 out of 9 symptoms for a minimum period of 2 weeks. 5 out of 9 symptom for a minimum period of 2 weeks. What are the 9 symptoms? Psych caps. Sadness of mood, decreased interest in pleasurable activity, anhedonia. G for guilt feeling, E for energy lack, C for concentration lack, A for appetite reduced, significant weight loss, P for psychomotor activity reduced, slowing, S for sleep changes, S for suicide. All of you are supposed to know 5 out of 9 for major depressive disorder. Based on this information, answer case number 1. MDD or AD? You can type MDD or AD, or you can type 1 or 2. Yes. 18-year-old female. What is the stress here? Just started college, living by herself for the first time. Don't you remember many of you were 18 years of age when you were in first MBBS? Do you agree? And that was the first time when you started living in college alone from your family. Did you feel homesick in the first 3 months of MBBS? Did you feel trouble while adjusting to the new college? Did you feel troubled by the ragging happening in the hostel? Did you feel like you should quit the course and run away back to your home? क्या पहले 3 महीने of MBBS में मेरी statistics कहती है 15% of first MBBS student don't like being in MBBS after they join MBBS in the first 3 months. Do you agree? But this ratio reaches 45% in first year of post-graduation. In first 3 months of post-graduation, 45% people don't like their post-graduation. Remember this. भूलना मत इस बात को. The most common psychiatric disorder in medical students now is not depression, it is adjustment disorder related to the stressors in the life Okay, याद रखना इसको. Why I am not discussing about duration? Because duration criteria is not that important. Here, there is no onset within 1 month. There is no removal of the symptom within 6 months mentioned. Still, the diagnosis is adjustment disorder. Read the next case. It is not a delusion. It is adjustment disorder. Come on, you cannot make such mistakes. Yes. Talk about suicide. Correct. Can you differentiate adjustment disorder from major depressive disorder now? Can you differentiate adjustment disorder from major depressive disorder now? All of you confident about it? Give it a try. inicet PYQ. Case number 3. Please highlight and mark those points which I'm marking right now on the screen. Yes. Lost his job. When you talk about job, mood become worse. मतलब आपसे जब मैं पढ़ने की बात करता हूँ तो आपका मूड डाउन हो जाता है, लेकिन जब मैं आपसे रन विजय की बात करता हूँ या फिर अबरार की एंट्री की बात करता हूँ तब आपका मूड अच्छा हो जाता है, क्योंकि आप अभी अभी एनिमल देख कर आए हैं. इसको क्या डिप्रेशन बोलेंगे? When I talk to the patient about loss of job, he feels sad, but he went for a movie. ये क्या है भाई? What is this? Adjustment disorder. Got it? Case 4, NEET PG 2020 PYQ. And now the options are the down 6. Case 4 is a type of depression. 1, 2, 3, 4, 5, 6. Where will you keep it? 1, 2, 3, 4, 5, 6. Where will you keep case 4? Come on, quick. Yes. It is MDD with psychosis. Presence of mood congruent delusion and hallucination. This is a mood congruent auditory hallucination. Do you people know what is mood congruent hallucination? As per the mood, the voices are telling him to die. These are not the voices in schizophrenia. In schizophrenia, the voices say, I will kill you. In depression, the voices say, you are useless, you are hopeless, you go and die. जाके मर, अबिच मर, go and die. I was trying some Manish Chavda stunt. Yesterday I was looking at him when he was taking an online class and he was about to come out of the camera. I asked him, he's a very good friend. Actually, I am in the middle part of dams. My teachers are teaching at dams, my students are teaching at dams. Manish Chavda, Shagun Mehta are my students, and the next in line is Dr. Rajiv Tiwari, my respected teacher at dams. 32 people are there in this DVT. 4 of them are my teachers, 2 of them are my students, and remaining 26 are colleagues. Whatever. So we keep on mocking each other. That's very normal. So mood congruent delusions and hallucination. Mood congruent auditory hallucinations. This question was marked as schizophrenia. This question was marked as schizophrenia by many students in the exam. The question was hearing voices. So student mark it as schizophrenia. Please remember, hearing voices is not schizophrenia. You have to see the content of the voice. सिर्फ आवाजें आना schizophrenia नहीं है. आवाज कह क्या रही है ये भी important है. Mood congruent auditory hallucination. Voices. This is not thought insertion. What is dysthymia? Low mood more than 2 years. What is depression? Double depression. Depression on top of dysthymia. Depression on top of dysthymia. What is atypical depression? Reversal of vegetative symptoms. Do you know what are the vegetative symptoms in depression? Low mood. Vegetative symptoms are decreased sleep, decreased appetite and weight loss. That's why when normally people have depression, they sleep less, eat less and weight loss. But atypical depression is more common in medical students. So it will sleep more, eat more and weight gain. When normal people have depression, they sleep less, eat less, weight loss. But when medical students have depression, honestly tell me, don't you feel like eating in the night when you have studied a lot? Don't you feel like eating too much after attending a 10-11 hours of DVT session? Not only you, I have seen teachers eating much after this DVT session. So stress eating is a very common phenomenon, very common. कभी स्ट्रेस में खाया नहीं आपने? मन खराब लग रहा है, कुछ खाते हैं शायद मन अच्छा हो जाए. आज मेरा मन अच्छा नहीं है इसलिए मेरा कुछ अच्छा अच्छा खाने का मन है. What a controversial statement. मन अच्छा नहीं है, अच्छा खाने का मन है. I am not feeling good, so I want to eat good. That is atypical depression. Geriatric depression. What do you mean by geriatric depression? You know, in online class, I don't need to entertain. You people are sufficient enough in the chat to entertain each other. All claps to the people in the chat who are entertaining the other students. So I don't need to do anything. आप एक दूसरे का मनोरंजन स्वयं कर रहे हैं और मेरा भी. Good. Keep it up. Continue. No problem. What do you mean by geriatric depression? Old age depression. Very good. मुझे तो पता ही नहीं था geriatric old age होता है. मैं तो सोच रहा था pregnancy का depression है. Geriatric depression is involutional melancholia. Involutional melancholia. Involutional age means old age. Melancholia means depression. Childhood depression. I will not ask you what is childhood depression. Otherwise you will say बच्चों का depression. That we all know. What are the 3 key signs of childhood depression taught to you in test and discussion batch this year? Question number 64. Neet TND. Also was there in inicet TND. Also was there in fast track TND. I have taught childhood depression. The people who are fast track TND, is there anyone who knows this? There was one batch. Are you attending DVT today? Where I taught so many types of depression. Yes, you are right. School refusal. Somatic symptoms like headache and quarrelsome. So Sneha knows 13 type of depression, which only Sneha knows. Very good. Samriddhi also knows 13 types. Pallavi also knows. Pooja Pallavi. Abhishek Roy also knows 13 types of depression. Wow. Awesome. And these students know why I am again and again repeating 13 types. 13 types. These students know. So these are the types of depression that are the most important ones. Thank you, Yash. Next is postpartum psychiatric disorder. Come on. A woman will get anxious, mood swing, occasional sleep disturbance, sleeping 5 days after delivery. Come on, quick. What is the answer? Please explain quarrelsome meaning. Quarrel matlab jhagdalu. Quarrelsome. Jhagdalu. Postpartum blues. If the onset is within days of delivery, and the low mood is less than 2 weeks, but the most common symptom is always labile mood. Treatment is required? No, no treatment is required. If low mood crosses more than 1 month, within 1 month of delivery, antidepressant required. Rarely, if the lady attempts suicide, you might require ECT. Name the 2 new drugs approved for postpartum depression. Brexanolone and zuranolone. Two new drugs approved in postpartum depression. Brexanolone and zuranolone. Postpartum psychosis, again less than 1 month of delivery. Depression plus delusion against the newborn. This child when grow up might destroy my family. Better kill the child now. Does anyone remember the video of the patient shown in the class? Postpartum psychosis. When I was showing postpartum psychosis, some students were like, oh, how is she hitting the baby? But yes, baby is harmed. That's why we need to do mother to child separation. Treatment is antidepressant plus antipsychotic. A very, very important topic, postpartum. Moving on to case number 4. Don't worry, I'll finish in time. Don't worry about my speed. Let me take care of my speed. I'll finish in time. I don't exceed deadlines, you know that. And you will get to start surgery exactly at 12. Don't worry about timings. Let me take care of that. Bipolar disorder, unipolar and bipolar depression. What is the difference between unipolar and bipolar depression? If the patient only presents with depression, it is called unipolar depression. If the patient presents with depression and a past history of a manic episode, we call it bipolar depression. A patient A came to me, 3-month sadness, low mood, anhedonia, decreased energy, no past history. It is called unipolar depression. A patient B came to me, 3 months of low mood, anhedonia, decreased energy, but with the past history of mania 3 years back. What is the diagnosis of A? Unipolar depression. What is the diagnosis of B? Bipolar depression. Are you clear? Why do we need to differentiate these two? Because the treatment is different. In unipolar depression, treatment is only antidepressant. And in bipolar depression, treatment is antidepressant plus mood stabilizer. So in every case of depression, you are supposed to ask a past history of mania. If past history of mania is present, it is a bipolar depression and you need to add mood stabilizer. If past history is absent, it is a unipolar depression. You just need to give antidepressant. Is that clear? अगर यूनिपोलर डिप्रेशन है तो सिर्फ डिप्रेशन को ठीक करना है, लेकिन अगर बाइपोलर डिप्रेशन है तो डिप्रेशन को भी ठीक करना है और फर्दर एपिसोड्स को भी प्रिवेंट करना है. अगर आपने ये नहीं दिया, suppose you don't give mood stabilizer to B, depression will be cured, but he might go into drug-induced mania. Look at the case asked in NEET PG 2020. What is the case? The patient was started on imipramine. What is imipramine? An antidepressant. And developed new symptom, increased excitement, cheerful, colorful clothes, increased talking. This is a case of drug-induced mania. How do you manage? Continue antidepressant or stop? What's your answer? Continue antidepressant or stop? Stop, because imipramine was the causative agent. Stop antidepressant and give antimanic. This was a question asked in NEET 2020. Done? Done? Most important adverse effects. These drugs are really important, and please remember Dr. Sachin said in the class, predicted question for NEET 24. The predicted question for NEET 2024 is side effect of psychiatric drugs. Either SSRI or lithium valproate or antipsychotics. One out of these three is very likely to come in the exam. My predicted question for NEET 2024, side effect of psychiatric drug, either SSRI or lithium valproate or antipsychotic. Very famous question. If this question comes, you let me know after the exam. No Shifa, because we are giving antimanic, which are mood stabilizer. Sahil, for your information, antimanic are same as mood stabilizer. I think you need to work on your basics more. SSRI. Most common side effect: upper GI dysfunction, nausea, vomiting. Most common long-term side effect: sexual dysfunction, and orgasmia. That's why they are the drug of choice for premature ejaculation. Metazapine. Most common side effect is sedation. Increase Govind, inicet. Bupropion. This drug has no sexual side effects. Rather, it increases libido. But the side effect is seizure. So antidepressant that is contraindicated in epilepsy patient is bupropion, because it is the only pro-epileptic antidepressant. About lithium, whatever you may read is not enough, because lithium is a very, very important drug. But at least I can tell you side effect: fine tremors, acne, polyuria, polydipsia, diabetes insipidus. But toxicity: coarse tremors, because lithium is toxic to CNS, kidney failure. Lithium is toxic to renal. You know why I'm mentioning one or 2 points? Because I feel these are the most important points. Suppose you are revising last 1 week only DVT, then you will revise psychiatry for at least 1 hour. At least 1 point about lithium and valproate will come in psychiatry notes. Valproate also causes tremor. Students sometimes forget that valproate also causes tremor, weight gain, alopecia. Rare side effects. One of them was asked in recent inicet: hyperammonemia, pancreatitis, etc. Hepatotoxic it is. We can keep on writing whatever we want, but at least these points you are supposed to remember. Can we move on? Section propranolol. Tangentiality example given today itself. Yes, Aritra. Therapeutic dose related side effects are there. 0.6 to 0.8, 0.8 to 1.2, more than 1.2. Every blood level has different side effect profile of lithium. There are a few charts given about lithium in the inicet PYT session. If you're targeting that exam, make sure to see that charts. SSRI causes sexual dysfunction, hence used for premature ejaculation. No sexual side effect, bupropion. Least sexual side effect, metazapine. inicet question. Case 5, anxiety disorder. There were students who were not able to differentiate GAD from panic, but it's not that difficult as we feel it. GAD is generalized anxiety disorder. Generalized, as the name suggests, continuous. Free floating anxiety. These are the people who are always worried for more than 6 months. As contrast to that, panic is an episodic anxiety. One panic attack, then in between normal. Another panic attack. Panic is characterized by sudden catastrophic anxiety with a feeling of impending doom. The same question was asked in NEET 2023. I suppose all of you who are post interns, that is 2017 batch of MBBS and above, have you written NEET PG 2023? Probably yes. 5th of March 2023, morning 9 am. 9 am is important, you know. NEET exam is morning 9 am. This was the question. Current year NEET PG question. It's actually a repeat similar to NEET 2022. If you would have done 2020 PYQ, you could have answered 2023. That's why PYQs are very important. Come on. 2023 PYQ. Come on. Answer. GAD or panic? Just answer with alphabets. Panic. This question was marked by 30% students as GAD by just looking at 6 months. Because I only taught them GAD is 6 months, but I didn't say episodic. Episodic is always panic. And moreover, even panic disorder requires more than 1 month of symptom. And 1 is above 6. 6 is above 1. तो पैनिक में भी कोई ड्यूरेशन तो चाहिए होता है ना. Fear of impending heart attack, feeling of impending doom, the characteristic feature of panic. That's why I'm telling the problem in psychiatry is, even if you know key feature, even if you know how to solve, then also you make a mistake. Problem क्या होता है? You apply your own concepts which you have formed while understanding and interpreting psychiatric disorder. In psychiatric disorder, the most important thing is interpretation of the symptoms. A patient tells me the symptom in his or her own language. How do I interpret? That's how I teach you. Because I am a full-time clinician practicing psychiatry. But the problem is you put your own interpretation. नहीं, ऐसा तो bipolar होता है. ऐसा तो depression होता है. I have seen people throwing diagnoses at each other. One of your friend was happy in the morning, sad in the evening. Hey, bipolar, bipolar, bipolar. You use psychiatric diagnosis like a slang. Hey, तू तो depression लग रहा है मेरे को. Hey, तू अकेले अकेले बात कर रहे थे को schizophrenia हुआ है क्या? Come on, यार. In psychiatric diagnosis, remember only one thing. Only apply whatever I have taught you, whatever teachers have taught you. The moment you start investing your things into it, the diagnosis will overshoot. The diagnosis will overshoot. Be careful. There are strict guidelines of diagnostic psychiatric disorders. This out of this symptom, this duration. One day somebody is becoming angry, you call him mania. Is it so? We were dancing yesterday in DVT auditorium. You make a photo and send it to me. What is it? Will I say mania? Understand the context. Understand. Read this question. Constantly worries. Can you differentiate GAD from panic now? Please be confident. Can you differentiate GAD from panic now? ये मैं आपको वो weapon सिखा रहा हूं. I am giving you weapons to fight the questions in the war. And I am giving you weapons and I am training you how to use these weapons. ये आपके तरकश में डाले हुए वो तीर हैं जो मैंने आपके तरकश में डाले, जिससे आप क्वेश्चन रूपी दुश्मन को एग्जाम में मारेंगे। मार के आओगे ना पक्का? यू आर सपोज टू मार्क दीज क्वेश्चंस करेक्ट। सोचो अगर टीचर आपको क्लास में सिखा दे जीएडी ऐसा होता है, पैनिक ऐसा होता है, उसके बाद भी आप इसको एग्जाम में गलत कर दो, डज दैट मेक सेंस? प्लीज अंडरस्टैंड, मैंने बहुत एम्फेसिस दिया है जीएडी एंड पैनिक बिकॉज दिस हैज बीन आस्क्ड 2 times in last 4 exams in NEET PG. 2 times in last 4 exams. NEET 2022, NEET 2020 and NEET 2023. Feeling of impending doom. What is the answer? First MBBS students, impending doom, going from one doctor to another, getting investigation, investigation normal. Panic. Case 6, bodily symptom. If the patient presents with bodily symptom, the diagnosis can be somatization, somatoform pain or hypochondritis. How do you differentiate them? If the patient has multiple somatic complaints, it is somatization. Multiple somatic complaints, it is somatization. This pain, that pain, GI symptom, GU symptom, जल रहा है, पूरा बॉडी जल रहा है, भाप जो है वो पैर से उठ के आ रहा है, माथा को गर्म कर दे रहा है और यहां से शू करके निकल रहा है, बर्निंग सेंसेशन ऑल ओवर द बॉडी, दिस बर्निंग, दैट बर्निंग, टिंगलिंग नमनेस, हाथों पैरों में झिन झिन हो रहा है, मिन मिन भिन भिन झिन झिन, सनसनाहट, थरथराहट, फरफराहट, ऐसे लग रहा है कोई यूं करके बोल रहा है. All these are somatization. Multiple somatic complaints. Multiple complaints, multiple doctor visit, multiple investigation, investigation normal. Only pain symptom. I have leg pain, I have knee pain, I have shoulder pain. Only one pain, but for long duration. And if he is preoccupied with a life-threatening disease, I have cancer because I have cough, I have brain tumor because I have headache. That's why in this there's a fear of having a disease called illness anxiety disorder. This happens mostly when you read about a disease. You read about a disease and there are 10 symptoms and you suddenly find 3 or 4 in you and you feel like you are having this disease. This is called third year MBBS syndrome. When in third year MBBS student enter into clinical branches, did you feel that there are some student, especially from non-medico family, muggles, मगलू होते हैं ना हर क्लास में कुछ, तो वो जो मगलू होते हैं उनको किताब पहली बार पढ़ के क्लिनिकल पोस्टिंग में पहली बार जाके ना हर चीज अपने से संबंधित लगती है, ये मुझे है, ये मेरी माँ को है, ये मेरे बाप को है, ये तो हमारे घर में सबको है. This, you know, the new budding doctors, third MBBS, they diagnose so fast, even faster than a MD consultant. And thankfully nowadays they don't read psychiatry textbook. नीरज आहूजा, फर्स्ट पेज ये मैं हूँ, सेकंड पेज मेरा भाई है, थर्ड पेज ये मेरी पुरानी वाली गर्लफ्रेंड थी. Everything feels so related that they become anxious about having a disease. That is called hypochondritis. Eating disorders. There are 3 types of eating disorder: anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa. I will teach eating disorders in 45 seconds. Anorexia nervosa is characterized by A, B, C. Bulimia nervosa, B, C. Binge eating disorder, B. Finished. What is A, B, C? Avoidance, binge, compensation. Bulimia will have only binge and compensation, no avoidance behavior. So the difference between anorexia and bulimia is no avoidance. Binge eating disorder will only do binge, no compensation. Finished. 45 seconds, eating disorders finished. ज्यादा से ज्यादा क्या आएगा, डिफरेंस ही तो आएगा. Look, if there's a question on eating disorder, I have repeated this so many times. If there's a question on eating disorder, the one of the option is anorexia nervosa, other has to be bulimia nervosa, na? So it is not important to know anorexia nervosa. It is not important to know bulimia nervosa till you don't know the difference. Difference is what takes you higher in an MCQ. नहीं खाएंगे, फिर एक दिन बहुत सारा खाएंगे, फिर निकालेंगे, सिर्फ खाएंगे. Binge eating disorder people only eat. After that what they do? Nothing. Eaten, so what I have eaten? Eaten of my own money, not of your father's money. खा लिया, तो क्या वो खा लिया? तेरे घर से खाया, तेरे बाप का खाया, dash, censored. These people are previously called foodies. Now in your world of Instagram, we call them as food influencers. Have you seen some profiles? They eat and make a video out of it, so that the one you who is dieting, the motivation gets closed. देखा है कुछ लोगों को जो खाते हुए वीडियो बना के डालते हैं? Normal weight, underweight, overweight. Personality disorder, again a correlatable topic. Personality disorder. First you need to know the cluster A, cluster B, cluster C. Cluster A, cluster B, cluster C. A is odd and eccentric. Odd means different, eccentric means out of the box, out of the center. हट के सोचने वाले, हटेले. Schizoid, schizotypal, paranoid. Learn this. B means dramatic and emotional, dramebaz, nautanki. Antisocial, histrionic, narcissistic, borderline. C means anxious and fearful. A, odd and eccentric. Schizoids mean emotional coldness, thande log. They don't react, they don't interact much, they are in their own world, in their fantasy world. No matter what happens, you tell them tsunami coming, people dying, they say let it be, I don't care, I don't give a dash. Censored, I can't say in the class. Schizotypal. Schizotypal are the people who have magical thinking, odd beliefs, power of the sun, power of the star. It was written in the star that I should have 2 children, therefore I have 2 children. In my dreams I saw a train to Hogwarts. J.K. Rowling. Schizotypal. Paranoid personality. Paranoia means suspicious. The one whose personality is suspicious will doubt somebody or everybody. Everybody. Generalized mistrust. No one is trustworthy. कोई विश्वास के लायक नहीं. सब धोखेबाज है. That's why they lack friends. They lack close friends. They lack friends because they believe friends have some ulterior motive. They don't believe in friends. They only believe in friends with benefits. No strings attached. I don't know you. Dramatic and emotional, antisocial, psychopath, gunda. These are the people who love to break the rules because they say rules are for the bloody fools. It is the adult version of ODD converting to CD, converting to antisocial personality disorder. Perpendicular, Faisal Khan, Danish Khan, Sardar Khan, any one of these, Voldemort. Antisocial. Histrionic, attention-seeking personality. They love to be the center of attraction. Some mujhe hi dekhe, bas mujhe hi dekhe. I'm the only beautiful woman in this world. Look at her. She doesn't know how to carry herself. I know how to carry myself. And they want you to notice them. If you don't notice them, they feel very bad. ये कौन है जिसने पू को मुड़ के नहीं देखा? Attention-seeking, histrionic. Here comes the one personality which you know about. Self-love, narcissistic, खुद से प्यार. They want constant admiration from others. The speaker just before me in online DVT. You know him pretty well. the class went till 11 p.m. yesterday night. At the same time when he was teaching here, I was in the auditorium. Today I am here and he's in the auditorium. My friend, my colleague. Okay, because it is a good part. Personality characteristics are seen in many people. Many people. You have to love yourself so that people love you. But sometimes people love themselves so much. Have you seen somebody's status? मैं अपनी favorite हूँ. Okay, हो तो हो, ये हमको क्यों बता रहे हो? है ना? पापा की परी, माँ का परा. Narcissistic. Borderline. What is borderline? Emotionally unstable personality disorder. These are the people who cannot maintain their emotions. This is the only personality with self-harm. Whenever you see suicidal attempt, relationship issues, goes towards borderline. Also parasuicides. Cluster C, avoidant. Introverts. They avoid socially demanding situations. They never come in front. In a classroom, they make sure they sit at the back. Even if the seats are available in the front, they sit at the back. And you know, I walk in the classroom. You might have seen me in a face-to-face class. When I go toward them, they look in their copy. Dependent are the people who lack decision-making skills. They can't make their point with confidence. They do what the others tell them to do. There are some people who are so dependent, they keep on asking every time, you tell me now, how should I study? You tell me now, how should I study? Have you seen one of your batchmates or friends who always keep on asking, how should I study? And if he's asking a teacher, that's still okay. If he's asking a mentor, that's fine. But he's asking you, who yourself don't know what to study. मुझे सबसे अच्छा तभी लगता है जब आप दोनों एक दूसरे को बताते हो कैसे पढ़ना है. ना इसको आता है ना उसको आता है. A PG aspirant teaching another PG aspirant, blind leading a blind. Very good. Decision making skills. Lack decision making skill. Dependent. Some people are not able to make decisions. Anancastic personality disorder. These are people who are preoccupied with rules, regulation, perfection, symmetry, orderliness and cleanness. Everything I want in the right way. In the right way. In DVT class also, some of you are carrying 4 colored pens, 3-4 color highlighter, and there's one girl who is carrying a scale, making margins, and there's one of you who is carrying a whitener. If you are sitting in a classroom, look around yourself. There must be one girl or one boy well equipped with tools to make the notes, because they want notes to be perfect. Perfectionism ज़्यादा ज़रूरी है. Everything exactly where it is, at its place where it is supposed to be. I suppose you have attended microbiology at DAMS. Okay. Neurotransmitters in psychiatry. Dopamine, serotonin, norepinephrine, acetylcholine, GABA, glutamate. You know, personality traits are present in every one of us. Please don't diagnose each other. Even I have a few personality traits. All of my family, all of my friends are having personality traits. That doesn't mean they have disorder. I was just talking about traits. Make a chart. Make carefully. In schizophrenia, dopamine and serotonin are increased, rest of the four are decreased. In depression, dopamine, serotonin, norepinephrine are decreased. Whenever dopamine is decreased, acetylcholine is increased, GABA decreased, glutamate increased. In mania, norepinephrine, dopamine are increased, serotonin no comments, acetylcholine decrease. In anxiety, serotonin is altered, increase, decrease, norepinephrine increase, GABA decrease. In dementia, acetylcholine decrease, therefore dopamine increase, and then glutamate increase. Come on. Most important neurotransmitter in schizophrenia out of these six. Most important neurotransmitter in schizophrenia out of these six. Come on. Most important neurotransmitter in depression out of these six. Most important neurotransmitter in mania. Most important neurotransmitter in anxiety. Most important neurotransmitter in dementia. Acetylcholine. Speaking about dementia, how do you diagnose dementia? Amnesia, apraxia, agnosia, aphasia. Plus loss of executive function, multiple cognitive domains affected, global cognitive decline for more than a period of 6 months. But how do you subtype dementia? Subtyping dementia means gradually progressive, more in females. What is the diagnosis? I'm not teaching these are the features of Alzheimer, these are the features of frontotemporal, these are the features of Lewy body. I'm teaching reverse. How the question is asked. If this is the question, what is your answer? Come on. First one, Alzheimer. Yes, Shubhi Jain. Correct answer. It is the most common dementia. Second, step ladder progression, emotional ability, more in males, high BP. Vascular, post-stroke dementia. Personality and behavioral symptom predominant, memory is less affected. FTD, frontotemporal dementia, also known as Pick's disease. Visual hallucination, movement problem, fluctuating, and Capgras syndrome is seen in LBD. Lewy body dementia. Dementia, urinary incontinence, and ataxia. And pH, normal pressure hydrocephalus. Rapidly progressive dementia, myoclonus corneal transplant. CJD. Very, very important chart. You'll not find this chart ever anywhere else because these are the key features picked up from the question and the answers. Please don't make a mistake in this one. We are in time. Now comes with the rapid fire one-liners. Are you ready? Okay, somebody is asking me full form of CJD. I suppose you know it. Creutzfeldt-Jakob disease. Second is vascular dementia. Vascular means post-stroke dementia. Do you know in the last 90 minutes we have done 154 questions in psychiatry? Technically 154. You go back and count. You will not realize it. When you start doing questions, you will realize it that there are so many things that were covered. And in the next 15 minutes, I target 50 more one-liners. Are we ready? Are we ready? Chapter 1, General Psychiatry. All these are either PYQs, either already asked or likely to be asked, important topics picked up by myself. First question. Healthy thinking includes all except. You don't even know the options. So let me give you the options. The options were constancy, organization, continuity, and clarity. Come on. This question was asked in AIMS 2011 exam, the exam which I gave for my PG entrance. Although I have not done from AIMS, but I gave this exam. Constancy, organization, continuity, clarity. Come on. Clarity. Yes. This is an AIMS question and it can be repeated. Purpose of classification in psychiatry are all except. And the options were communication, control, comprehension, coordination. Come on. Communication, control, comprehension, coordination. All India PG 2016 question. Come on, quick. Yes, coordination. Who coined the term psychiatry? John Reel. Ambivalency is most commonly seen in options: OCD, schizophrenia, depression, bipolar. OCD, schizophrenia, depression, bipolar. Ambivalency is most commonly seen in OCD, although it is a foray of schizophrenia. Illusion is also known as All India 2015 question. Pareidolia. Incongruent affect is seen in parathymia. Incongruent affect is seen in. You might feel this is a cramming of the facts, but when there's a 1 week left to the exam, you are supposed to learn these, because if anything gets repeated from this, you are supposed to know this. The people who have already attended the lectures, they know these terminologies. Please don't think so that you are done with psychiatry or any other subject with only DVT. DVT is just revision of the things that have been taught. But you have to read what has been taught. MSc is used to test cognitive functions. Serial 100-7 test is used for testing attention and concentration. Similarity test is used in psychiatry for abstract ability. MMSC is a screening test for which disorder? Dementia. Less than 24 out of 30 is dementia. Schizophrenia term was coined by Eugene Bleuler. Best for 100-7 is concentration. Schizophrenia is also known as dementia precox. Prevalence of schizophrenia 1%. Most important neurotransmitter in schizophrenia, increased dopamine. The neurotransmitter which explain both positive and negative symptom, serotonin. Motor symptom are predominant in which schizophrenia? Come on, waiting for your answer. Options are catatonic, simple, paranoid, hebephrenic. Catatonic. First line treatment in catatonia. IV lorazepam. Worst prognosis schizophrenia. Simple. Negative symptoms are predominant in simple. We are about to complete in the next 10 minutes, maximum 10 to 15 minutes. Name the syndrome. Delusion of infidelity. Come on, which syndrome? Or morbid jealousy. My partner is not loyal. Gairaiya, Rustam. Now I should say coffee with Karan. Delusion of love. Erotomania. T. Claremont syndrome. Delusion of doubles. Capgras syndrome. And delusional parasitosis. Ekbom syndrome. Second last page of the day. Prevalence of depression in India. Ekbom is my body is infested with worms. Prevalence of depression in India 5%. Most important neurotransmitter in depression. Decreased serotonin. Decreased need for sleep is seen in mania. Most common method of suicide in India. Fast. We are doing a fast revision. Come on. Most common method of suicide in India. Hanging. Biochemical marker of suicide. Decreased CSF level of 5-HIAA. Very famous question. What is bipolar 1? What is bipolar 2? What is cyclothymia? Half mania and half depression. Hypomania and subsyndromal depression. What is the prevalence of bipolar disorder? 1%. Minimum duration needed to diagnose hypomania. 4 days. The reason we are writing these one-liners right now is that I suppose that in the last 1 week before NEET PG you might revise these DVT notes, and these one-liners, the most frequently asked ones, should come in your vision. Do you get the idea? ये ऑलरेडी फिल्टर किए हुए वन लाइनर है, इसमें और फिल्टर प्लीज कृपा करके ना लगाएं. पिछले नीट पीजी में एक स्टूडेंट मुझसे डीवीटी में से पूछ रहा है, सर इसमें से इंपॉर्टेंट कौन सा है. मुझे 1 या 2 घंटे दे रहे हो पढ़ाने के, उसमें भी मैं क्या नॉट इम्पॉर्टेंट चीज पढ़ाऊंगा? मतलब इतना बार्गेनिंग. पहले इंपॉर्टेंट बताओ, फिर मोस्ट इंपॉर्टेंट, फिर अल्ट्रा इंपॉर्टेंट. एक दिन पहले यही बता दो ना, सर आएगा क्या कल. मुझे कैसे पता क्या आएगा यार? वी कैन जस्ट गेस, वी कैन जस्ट मेक प्रिडिक्शंस, वी कैन नॉट बी कॉन्फिडेंट ऑन what is going to come. 70% of the exam you are going to attempt from your recent memory, which is the last 30 days of your preparation. 30% of the exam you are going to attempt for your remote memory, which is last 11 months, 1 year or 5 years of your preparation. Make sure that the last 30 days don't get wasted. If last 30 days get wasted, it will badly affect your performance in the exam. If you have any functions or programs in the last 30 days, better to be avoided. Last 30 days of the exam, you are supposed to engrill everything in your recent memory. Recent memory lasts for maximum 30 days in most of the people. Remote memory is unlimited. आखिरी 30 दिन आपके जिंदगी के ये निर्णय लेंगे कि आप कौन से कॉलेज में पोस्ट ग्रेजुएशन करेंगे. मैं ये नहीं कह रहा हूँ कि पोस्ट ग्रेजुएशन करेंगे या नहीं करेंगे. विद द इंक्रीजिंग नंबर ऑफ सीट्स, प्रैक्टिकली almost more than half of you are going to get post graduation seats. It's not about getting a seat anymore in NEET PG. It's about getting a seat in the college of choice, in the branch of choice. Remember my words, that you will get the college or the branch depending on your score, and that will change your life. Certainly change your life. Neurotic disorders. Most common type of phobia. Agora, social or specific? Specific. All phobia cause tachycardia except blood phobia, which causes bradycardia. Minimum duration of symptom required to diagnose PTSD, 1 month. Most common body part involved in body dysmorphic disorder. Hair, nose or skin. Hair. ERP has poor prognosis in hoarding disorder. Pseudologia fantastica is seen in factitious disorder, also known as Munchausen syndrome. Conscious production of symptom with a goal or motive is seen in malingering. Astasia abacia and La Belle indifferent are seen in conversion disorder. Most common symptom of PTSD. ERP is exposure and response prevention. Intrusiveness. Most common type of dissociative disorder. Amnesia. Dissociative are 4: fugue, amnesia, depersonalization, derelation, and identity disorder. Last page, I suppose. Ready? Narcolepsy is due to deficiency of hypocretin or oprexin. Somnambulism is most commonly seen in children. Best treatment for nocturnal enuresis. Bed alarms, wetness sensor alarms. Excessive sexual desire in male is known as AIPG question, satyriasis. Premature ejaculation is a disorder of orgasm. Squeeze therapy is used in premature ejaculation. Neurotransmitter decrease in delirium. Acetylcholine. Hallmark feature. I think I told you this on the page 1 itself. Altered sensorium. Disorientation. Confusional assessment method is used in. Confusion is the other name of delirium. Most important feature of Korsakoff syndrome. Enterograde amnesia, recent memory loss. Finally, at the last table of the day. Most important table. Summary of treatment. In psychiatry, they will only ask you a disorder, drug of choice and therapy of choice. I already told you schizophrenia and delusional are psychotic disorder, hence we use antipsychotic. And there's no predominant psychotherapy to be remembered here. We don't do psychotherapy too much in psychosis. In depression, SSRI is the drug of choice, but CBT, cognitive behavioral therapy, is the therapy of choice. Mania, anti-manic is the drug of choice. Again, we don't have any proper psychotherapy in this. We use behavioral therapy in phobia and panic. For panic disorder, the drug of choice is SSRI, but for panic attack, the drug of choice is benzodiazepine. These are the drug of choice. Phobia, SSRI, therapy of choice, systemic desensitization, gradual exposure. OCD, drug of choice SSRI, therapy of choice ERP, exposure and response prevention. Trichotillomania, SSRI, habit reversal. Acute stress disorder, benzodiazepine, no specific therapy. PTSD, SSRI is the drug of choice, CBT is the therapy of choice and EMDR is a new therapy. Conversion disorder. Adjustment disorder. SSR is the drug of choice. Supportive psychotherapy, where we teach coping skill, is the therapy of choice. Conversion disorder. No specific drug of choice. You can use benzodiazepine for anxiety. Psychodynamic therapy is the therapy of choice. Last, dementia. Acetylcholine esterase inhibitors and cognitive remediation. Cognitive remediation, improvement of memory. Cognitive remediation. So I am about to complete my topic. I still have 2 more minutes left, which I'll utilize in saying just one last message to you for your preparation and motivation. As I discuss, today's theme of my lecture was differentiating the choices, because according to me, it's very important in life to make the right choice. Your life begins with an MCQ. There are always 2 choices. One is a right choice, one is a wrong choice. जिंदगी आपकी MCQ बन चुकी है, बनी हुई थी जन्म से ही। सबसे पहले नॉर्मल है कि CS है, ब्रेस्ट फेड है या फॉर्मूला फेड है, बच्चे को देना क्या है, ऑलवेज ऑप्शन। आप खुद भी सोचते हो व्हाट टू ईट, दिस और दैट, व्हाट टू वियर, व्हाट टू स्टडी, वेयर टू स्टडी, कौन सा कोचिंग, व्हाट टू चूज द लाइफ पार्टनर। MCQ में भी कुछ ऐसा ही होता है। There's always a right choice, there is always a wrong choice. Right choice gives you towards success and wrong choice regrets. मुझे ये नहीं, ये मार्क करना चाहिए था। Choices. It is always the choices. Either you make a right choice or you make a wrong choice. And I'll end that it is our choices that we show what we truly are more than our abilities. Albus Dumbledore. Hoping that you all make the right choice in the exam. There are 200 questions. Just make 160 correct choices. 80% correct paper. You'll get the branch of your choice. Thank you very much. So I'm closing the session for you today. So the next person after me would be my teacher in surgery. So we are done with all the 18 subjects except surgery.